Alrighty, I just came across a couple work from home jobs where you're going to do a whole bunch of data entry and scheduling patient appointments. I know a lot of you are looking for these kind of jobs, so let's jump right into them. So Adapt Health has an opening for an intake specialist. This job is full-time remote. You can do it anywhere within the United States, no location restrictions. And they tell us this role has a broad range of responsibilities, including accurate and timely data entry, understanding and selecting inventory and services in key databases, communicating with referral sources, and appropriately utilizing technology to notate patient information and communication. So it sounds like you're going to do a whole bunch of data entry and handle referrals from other healthcare facilities. So you'll communicate with referral sources, physicians, or associated staff to ensure documentation is routed to appropriate physicians for signature and completion. You communicate with patients regarding their financial responsibility and collect payment and documents in patient records accordingly. And you'll also be responsible for reviewing medical records for non-sales assisted referrals to ensure compliance standards are met prior to a service being rendered. You'll work with community referral sources to obtain compliant documentation and contact patients when documentation received does not meet payer guidelines. You'll provide updates and offer additional options to facilitate the referral process. So that pretty much sums up what you're going to do on a regular basis. They have more details. If interested, read through the details. Now, they list some responsibilities for a leadership position. I really don't know why they have it on this particular job description. They might be hiring an entry level as well as a senior position, but you'll have to confirm that with them. I'll get into the details on that in just a minute. So you need to be able to appropriately interact with patients, referral sources, and staff. You're comfortable on the phone. You have excellent customer service skills. You're comfortable using computers. You're familiar with Microsoft Office products. You have a high school diploma or equivalent, an associate's degree in healthcare administration, business administration, or a related field is preferred. And you have related experience in healthcare administrative, financial, or insurance customer service, claims, billing, call center, or management, regardless of industry. Now, for a specialist level position, they want you to have about 1 year work-related experience. For a senior level position, they want you to have 1 year work-related experience plus 2 years exact job experience. And for a lead level position, they want you to have about 1 year work-related experience plus 4 years of exact job experience. So I'm not sure if they're hiring for a specialist, senior, or lead level, perhaps all three. But regardless, if you only have 1 year work-related experience, definitely apply for this one if it interests you. Now, they're not telling us how much they'll pay for this job, but based on my experience looking at similar roles, I have a feeling you can make anywhere from $16 to $20, maybe up to $22 per hour, depending on the skill level. Now, I can't guarantee how much you'll make for this particular job. You'll have to work out your salary with them. So our next scheduling job comes to us from the company RSI RCM. Now, I've never heard of this company before, but I did find out they were founded in 1999. They're a legitimate, award-winning healthcare revenue cycle management company. So basically, they provide back-office services for the healthcare industry. They have an opening for a remote medical scheduler. It's full-time remote anywhere within the United States. You'll work Monday through Friday, 8 a.m. to 5 p.m. Eastern Time Zone hours. You don't have to live in the Eastern Time Zone. Translate your local hours to those hours. And you probably notice the salary, which is $17 to $19 per hour. So in this position, you'll be responsible for scheduling appointments for the client according to established protocols while maintaining superior customer service and professionalism. So you do a whole lot of phone work in this job, properly scheduling appointments according to established practice protocols, screening patients for demographic information and update systems as necessary, and verify method of payment for services. You'll also make sure necessary referrals are obtained and any necessary authorization are in progress prior to scheduling appointments, and inform patients of information or payments that must be presented at time of visit. And because this job is in the healthcare industry, you must be able to abide by all HIPAA and RSI policies and procedures, as well as local, state, and federal regulations relevant to your area of operation. You need a high school diploma or a GED, and they prefer you have about 1 year medical scheduling experience. That's just preferred, it's not required. They do want you to have basic knowledge of medical terminology, but if you don't have that knowledge, don't worry. In the description area below this video, I have a link to a really good free resource where you can pick up medical terminology. And of course, you need to be a good communicator. You have excellent customer service skills, as well as proper telephone etiquette. So that pretty much sums up this one. In fact, we just went over 2 work from home jobs where you're going to do a whole lot of data entry and patient scheduling. Hopefully one of them works out for you. And if you're looking for more easy work from home jobs, you can find some in this video right here. And hang in there, guys. The more videos I present, the more work from home job leads you have at your fingertips. Thank you so much for visiting. I truly appreciate your support, and I'll meet you on the next job lead.